good afternoon and good evening, depending on where in the world you are joining us from. As we just saw, there's a lot of people across many time zones joining the call today. I want to give you a warm welcome to today's information session for the Master of Global Health program at the University of British Columbia. I do want to begin by acknowledging that our campus, UBC's Vancouver campus, is located on the traditional, ancestral, and unceded territory of the Musqueam people. They've cared for this land for countless generations, and we're extremely grateful to be able to learn, teach, work, and recreate on these lands. If you're not familiar with the land acknowledgement, noting that this is a common practice that we use to work towards reconciliation and recognition of the Indigenous peoples of the lands of Canada, and something that you'll become well versed in if you take our program here at UBC. I do want to do a quick introduction to myself and the others on the call, joining from the Master of Global Health team. So my name is Nicole Kelly, my pronouns are she, her, and I'm the program manager of the Master of Global Health at UBC's School of Population and Public Health. I'm also joined on the call by Dr. Kumbo Kalua. He's the Associate Professor and Global Health Program Director, as well as my colleague Lena Kong. She's the Program Manager of Global Health and Strategic Initiatives. You'll be hearing from all of us at certain points during the presentation, but in the next 40 minutes or so, we will be collectively guiding you through the session to help you better understand what our Master of Global Health, or MGH for short, program is all about, and answer your questions. Just a note that today's session will be recorded. We're going to be using it to help us continue to improve and learn from your questions and such. We may be releasing this at some point, so please keep an eye on our website and your email for any updates on this. So now that you know a little bit about us, I would like to get a good sense of who's in the room. I know there's a number of you on the call, so we'll just do a poll to get a sense of that. Just give me one moment here and I will launch that for us in just a moment. Great. So if you can go ahead and fill that out, it would be great to know kind of what level of kind of education and work experience you're currently at, your field of study, as well as your motivation in looking into the Master of Global Health. I'll give you a few moments there. Wonderful. I see the poll is working. Fantastic. Looking forward to seeing everyone's responses. Wonderful. And we've got most people, about 75, almost 80% of people who have filled out the poll. So I'll close it in just another 30 seconds or so. But what I'm seeing from the trends here is that there's a lot of kind of diversity in our attendees today. So we have folks who are either current students or recent grads, as well as folks with several years and many years of work experience. And the field of study, I think, will be very telling too when we analyze the data after, but we're seeing a lot of interesting kind of backgrounds and professional backgrounds from people who are interested in our Master of Global Health. And then it's great to see as well that there's also some really interesting diversity in people's motivation to join the program. So some really, really interesting things to see here taking shape. Wonderful. So in terms of the session today, here's how our time will be organized. So we're going to begin at a high level, talking about the program vision and its global context, followed by a more specific look at the program structure and delivery. Then we're going to be talking about our partners and our career prospects for our graduates. And then we'll walk through the more nuts and bolts details of the application requirements, the tuition and funding opportunities. And then finally, we'll share a bit about how you can stay connected with us and learn about more events coming up. And lastly, we'll end with a Q&A, question and answer session to answer any questions you might have. I do want to note that many of you have submitted some really great questions when you registered for this session. So we've taken a look at those and we've tried our best to incorporate them as much as we could into the presentation. So please follow along closely. But we will also have time at the end for you to ask questions if they haven't been answered yet, or if you have new questions. So for those of you who might not be familiar with UBC, it is one of the top research universities in the world. It's ranked 38th in the world overall and 28th in the world for medical and health. And the Master of Global Health program is based in the School of Population and Public Health, or as we call it, SPPH. Our school brings together people from across disciplines to tackle complex health challenges. And this program is actually one of the newest ways we're building that global perspective into everything we do. So we're really excited to be launching this program. This will be the first year and the inaugural cohort that we will be welcoming in September 2026. A little bit more around where we are based out of. So we are located on the UBC Point Grey campus, which is in the city of Vancouver. And if you're not familiar, Vancouver is one of the most ethnically and culturally diverse cities in Canada. We like to think of it as a global health microcosm. It's really a place where local and global intersects every day. And this diversity creates almost a living laboratory for studying topics such as health equity, migration and health systems, and global social determinants of health. It's also home to some of Canada's leading health and research institutions, such as the Centre for Excellence in Indigenous Health, the BC Centre for Disease Control, and it also serves as a gateway to the Pacific Rim, connecting us to communities and partnerships across Asia and beyond. I also want to mention that Vancouver is a leader in Indigenous health and reconciliation, and we have some very strong collaborations that shape how we think about equity, decolonizing health practices, and culturally safe care models, as well as community well-being. And of course, Vancouver is a city deeply engaged in sustainability and climate action, issues that are central to global health today. As you can see from the photo, obviously the location of Vancouver really is just right adjacent to a lot of natural beauty. And so that kind of climate and sustainability piece is ever present and ever top of mind. Next, I would like to introduce you to Dr. Kumbo Kalua, Associate Professor and Director of the Global Health Program, to tell us a little bit more about the program vision and philosophy. So over to you, Kumbo.
Thank you, Nicole. Hello, everyone. It's my pleasure to be here with you today as the Director of the Master of Global Health Program. As Nicole has said, we have our first intake in the fall of 2026, and it's my hope that you can be one of our students. At its heart, the question that started the program is simple. Why does global health matter? The answer is that our world is more connected than ever, and so are the health challenges that we face. Climate change, pandemics, air pollution, and food systems don't respect borders. They affect every country, every community, and every one of us. The COVID-19 pandemic showed us how quickly local problems can become global. And climate-driven heat waves and wildfires here in British Columbia remind us that global forces shape local health outcomes every day. So when we say global health matters, we mean it matters for all of us, not just for communities abroad, but also for Canada and for our local neighborhoods. Global health isn't just about helping people over there. It's about recognizing our shared vulnerabilities, our shared responsibilities, and finding collaborative solutions to complex issues. That's the vision behind this program. As Western Canada's only professional global health program, we are building a space where students learn not only the knowledge, but also the skills to act, how to analyze evidence, how to navigate governance systems, how to approach health ethically and equitably, and how to work across cultures and disciplines. So in short, our vision is to train the next generation of leaders who can think globally and act locally. People who can build equitable partnerships, develop collaborative responses to complex health threats, and the lens of health to the work they're already doing, and make a real difference in the communities both here in Canada and around the world. That's why we are so excited about this program, and my role is to help you achieve this goal. Thank you. Back to Nicole.
Thank you so much, Kumbo, for sharing that vision. I know a lot of work has gone into developing this program and really addressing these global health needs. And so we're really, really excited to be launching. So let me allow you to take a closer look at our program, how it's structured, and what you can expect as a student in the program. So it is the only professional or course-based global health program in Western Canada, as Kumbo was mentioning. The degree is 20 months in length with a total of 45 credits, and there are 4 main components to the degree. So there are core courses, and these give you the foundations of working in global health. There's also thematic courses that let you dive deeper into key areas. There are electives that allow you to explore specific global health subspecialty areas of interest. And then also the practicum, where you'll have a focused opportunity to apply your learnings in the real world. So let's get a little bit deeper into those topics and understanding these aspects. So with the core courses, as mentioned, you'll build that foundation. So you'll start with courses such as looking at global burden of disease, epidemiology, biostatistics, evidence appraisal, and research skills. And these courses will really set the stage and make sure that everyone, no matter your background, has a common grounding in the field. Particularly because this program is an interdisciplinary program. It's meant to kind of address the needs of folks coming from a variety of academic backgrounds. And so those core courses are very important for building that common language and common understanding. We also have the thematic pillars. So beyond the core courses, you'll explore these 3 central themes that reflect the global priorities and UBC's strengths. So you can see that we have global environmental health, global health governance, and global health ethics and decolonization. You'll take courses from across all 3 pillars, so you gain a broad understanding and depth in each area. In addition to these core and thematic courses, you'll have room to tailor your degree with electives. So for example, you could take courses in things like food security, environmental policy, or international development, and really look at what are your interests and your career goals. These elective courses can come across other faculties across UBC so that you're really able to connect with other disciplines and other perspectives and kind of shape those pieces to make the degree kind of specific to your interests and your needs. Finally, we have the practicum, which is the highlight, I think the highlight of the program. It does culminate everything with a 6-credit course. So this is roughly equivalent to 3 months of full-time work, where you'll partner with an organization to tackle a global health-oriented project. And these positions can be either local or international. For example, you might work with a British Columbia city government developing strategies for things like extreme heat response, with an Indigenous health organization, or maybe with a health institute abroad. But we believe what matters most isn't the location, it's that the project addresses a global health issue and that you bring in lessons and approaches from multiple contexts. The program will actually have a list of practicum positions and projects available for students to choose from and apply for. Alternatively, if there's a geographical region or a subspecialty area that's not covered by our list of available opportunities, or if you have an organization that you're particularly enthusiastic to work with, you could set up your own practicum project with approval from the practicum director. To basically conclude around the practicum experience as well as the program, students, partners, employers, and faculty members will come together in a hybrid format symposium to share their experiences and to learn from one another. And that will be an opportunity for great learning across our students once they gather back together. I also want to talk about one of the unique features of our Master of Global Health program, and that's how it's delivered. So to make the program accessible for learners around the world, most required courses will be using a flipped classroom and a multi-access model. So essentially that means that the didactic content, so things like lectures and readings, will be delivered asynchronously, so you can engage with it in your own time on your own schedule. Then approximately every 3 weeks, each course will come together for a 3-hour synchronous class. And this works out to roughly 5 synchronous sessions per course spread out throughout the term. And you'll be able to join these either in person or online, so in a multi-access setting. To make scheduling easier, all of these synchronous sessions in a term will be grouped on 2 consecutive weekdays, so you're not juggling classes scattered throughout the week. You will receive that schedule beforehand, and you can make arrangements around them. And essentially, as I'll show in a moment, most times you're taking about 3 courses per term, so that means that you'll be spending about 9 hours every 3 weeks in those synchronous sessions, but those 9 hours are spread over 2 days. These live sessions aren't about repeating lecture material. Instead, they're designed for active learning, so discussion and problem solving and collaboration with faculty and peers. And one thing we want to make note of is that the Master of Global Health program does allow flexibility to attend these synchronous classes virtually, but you must attend your classes in person for at least one term. So committing to being present, being here on the campus and in Vancouver for those synchronous sessions for one of the terms will be really important. This is because global health is built on relationships, and so being here in person gives you the chance to connect more deeply with your instructors, with your classmates, and the broader UBC community. It's also an opportunity to network, to collaborate, and be part of conversations that happen organically in classrooms and different events. And the in-person time also allows you to experience UBC's really incredible learning environment. So we have research centers, student networks, and partnerships across the campus and the city. The program does have flexibility built in about when you will be here in person, and you'll have the opportunity to indicate your intention during the application process. So essentially, one term in person is required, but when you do it is up to you. And if you wanted to do more, you certainly could. One common question we anticipate might be in your mind is whether you can work potentially full-time while completing the Master of Global Health program, given this flexibility. And the honest answer is it really depends on you and your employer and your situation. The program is designed to be very flexible, but there are key times when you'll need to commit to synchronous classes, as mentioned, so about 2 weekdays every 3 weeks. So it's important to ask and figure out if your employer will be able to support you for taking that time for classes and engaging in this professional development, essentially, to really increase your skills and your knowledge that will hopefully benefit you as a professional and in your career. If your job does allow remote work, you might also be able to continue working while you're in Vancouver or while you're doing the practicum part of the program, but it does depend obviously on the nature of your role and the flexibility in those hours as well. So every situation is essentially unique and different, and we encourage you to have that conversation with your employer early if that's part of your intention, to talk about what's possible and what flexibility they can offer. But we do believe with some planning, students should be able to balance both work and study. So I wanted to show you how this would actually work through the Master of Global Health program schedule. So each course is offered once per year. So in order to graduate on time, you do need to take the course when it's offered. As we mentioned earlier, electives can come from a wide range of faculties across UBC, and so you're able to decide how to best fit them into your program schedule. Some of these electives may be offered online or in a multi-access, but not all. So just be aware of this and the potential implications on this that this may have on your location and when you decide to do your electives. If you pick an elective that's only taught in person, you obviously would need to be here on campus during that time. And I do want to share a little bit about our partnerships. So one of the things that makes the Master of Global Health program unique as well is the range of partnerships that we're building to support our students. I want to emphasize that this is a growing list, so many of these partnerships are being developed as we speak, and we expect the network to continue to expand significantly in the coming year and the years ahead. And so that's part of the excitement around launching a new program, that you as a student will get to benefit from these relationships that are constantly evolving and growing and be part of this kind of initiative of the kind of launch of the program. So these partnerships in practice, essentially, they're not just names on a list. We're working with organizations and universities that are in British Columbia, across Canada, and internationally, and they'll be involved in a variety of ways. So this could look like hosting our students for practicums, giving guest lectures, offering special talks, and collaborating on both academic and extracurricular activities. For example, we've had very promising conversations with municipal governments across BC who are really eager to host practicum projects on issues like climate resilience and health within built environments. We're also building connections with universities abroad, like Amref University in Kenya and Thammasat University in Thailand. We're really excited about student exchanges and joint projects. And we're engaging with NGOs such as Consortium of Universities in Global Health in the US, as well as MSF, Center for Chronic Disease Control in India, Indigenous health organizations, and other international research networks to open up even more opportunities. The bottom line is that these partnerships give our students direct access to real-world expertise, diverse perspectives, and practical experiences. And as the program grows, so will the range of voices and organizations that shape it. So when you're joining the MGH program, you're not just joining UBC, you're stepping into this large community of people and institutions that are really committed to advancing health equity around the world. Moving into looking at career outcomes, our Master of Global Health graduates will be well positioned in the job market. We know very well from labor market data and employer feedback that there is a demand for skill sets and knowledge that you'll develop in this program. You'll be able to work in a variety of sectors and roles, including things like government and health or social policy, international organizations, NGOs and nonprofits, research, or even private sector and consulting. Health is increasingly shaped by these global forces, such as migration, climate change, food systems, and conflict, among many others. And employers across many sectors are looking for people who can connect these dots and bring a global perspective to the local action. This is a trend we're seeing everywhere, including conversations with our global partners. Because we're located in the province of British Columbia, let's just use that as an example as we dig a little bit deeper here. So the 10-year labor market projections here in BC show that most job families that Master of Global Health graduates will be particularly suitable for will be among the fastest growing sectors in the next decade. These are known as what we call high opportunity occupations, and they include things like managers in healthcare, health policy research consultants and program officers, government managers, senior managers, and social policy researchers, consultants, and program officers. Here are some examples of positions that Master of Global Health graduates could be highly competitive for. These are just a small selection of real job postings with required knowledge and skills that align with the outcomes of the Master of Global Health. And you'll notice that they span a number of different sectors. This is because the Master of Global Health combines the academic training with practical skills. So things like evidence appraisal, program planning, policy analysis, and cultural humility. These are transferable skills that employers across many different sectors consistently tell us that they value. And of course, the practicum is central. It gives students the direct experience, a chance to build networks, and often a stepping stone to future employment. The pathways are clear here, that there's strong and growing demand for professionals with a global health perspective, and the MGH is designed to prepare graduates to meet that demand, whether they choose to build their careers here in Canada or internationally. Moving into some more specifics, so I'm excited to share that applications are now open, and we will be accepting applications and your supporting documents until Wednesday, January 21st, 2026. A few of the academic requirements we are looking for. So in looking at the GPA, you can see here that here in Canada, we usually use kind of B+ as our minimum, and the equivalent will be found on our GNPS or Graduate and Postdoctoral Studies website. I can insert the link shortly after, or Lena, if you have a chance. And you can look on this website for country-specific requirements and kind of check what the equivalency would be in the country where you received your degree. But those are the minimums, but please note that our programs are competitive, and so meeting the minimum doesn't guarantee entry. The English language requirement is a common question that comes up, but it's really, we only need to see English language test results as needed in certain scenarios. So if you completed your degree in Canada or the US, you don't need to show English language test results. If you completed a degree outside of either of these two countries, and the language of instruction was not English, then we would need to see that evidence of your English language test and meeting our requirements, which we have listed on our website. However, if you completed your degree elsewhere outside of Canada, outside of the US, and your degree was taught in English, and that was the main language of instruction, you do not need to send us English language test results. That is fine, and your transcript and proof that your program was taught in English will be sufficient to meet our requirements or our needs there. In terms of some of the other pieces, so we are looking for a letter of intent, or essentially this is in our application, what we call like statement of interest responses. So you'll see in our application, we have a number of questions prompting you about different topics we would like you to reflect on and consider as you apply. So these will be an important part of your application. We also need to see 3 letters of reference, and we really strongly recommend that at least one of these is an academic reference of someone who's a professor, who's seen your academic work and seen you in an academic setting. And we'll need to see your curriculum vitae or your CV resume as well. Noting on some of these pieces around admission and eligibility, the MGH uses a holistic evaluation to assess our applicants. So we don't just look at your academic performance in isolation. We will consider the whole picture of an applicant. So in addition to the academics and the preparation you've done, we're also looking for professional and volunteer experience, your goals and your aspirations, and the references, perspectives that they'll provide when they complete your reference form. So in short, it's not about being perfect in one area, but really showing the overall potential to succeed in the program and contribute to the learning community. And your commitment to advancing global health will be an important part of this as well. In some cases, we may invite certain candidates for an interview after the initial stage of review. And we also encourage you to apply early so we can alert you about any missing documents if you're able to do that. Moving into tuition and financial support. So you can see here the total program tuition for the 2026 cohort. So overall, these are the tuitions. So over the 20 months, it will be 27,540 Canadian for domestic students. So that's the total for all 5 installments. These will be broken down into smaller installments of about 5,500, but the total cost of the program for a Canadian or a permanent resident would be that. And then you can see the international tuition as well there. So that's 31,500. And again, broken down into smaller installments. You can see the US equivalency there, but that's just as for you to note in case that's kind of what you're used to looking at costs in. We also, you'll have student fees. So these include our kind of student government, or what we call AMS and GSS, Graduate Student Society, extended health and dental, UPass, and what we have is called an IMED fee for international students, or your medical insurance. The Master of Global Health program, unfortunately, is not eligible for Canada student loans, so it's really important for you to be financially prepared and ensure you have sufficient funds to complete your studies. But we are happy to announce that the program will offer a few bursaries for students in need. And due to the way the bursary is structured, the number and the dollar amount offered will vary from year to year, depending on how many students are in the program. Please note, though, that this bursary won't cover the full tuition, but may help to offset some costs. And our criteria for this bursary are still being determined, but please stay updated on our website. We have a place for tuition and awards information, and you'll be able to see more details about this coming soon. But students who are offered admission will also receive instructions on how to apply for the bursary. Some of the other ways that you can support your studies while you're in Canada are through roles like teaching assistants or TAships, as well as work-learn opportunities, which are on-campus working opportunities that are paid. So these can come from either the Master of Global Health program, the School of Population and Public Health more generally, or even other places across UBC. We also have a GNPS, or Graduate and Postdoctoral Studies Awards page, to see where you can see a list of award or funding opportunities curated by those folks. But just note that a lot of those scholarships are usually tied to research-based master's degrees, and as our program is a professional degree, not all of them will apply. So please read the eligibility criteria carefully. So I know a number of you actually on the call as you were registering for the session. I happened to see that a number of folks are planning to attend our sample lecture, but I did want to share with those of you who aren't aware yet that we are excited to be having Dr. Michelle Omri doing a sample lecture for us coming up on November 4th. So please visit our website or use the QR code here to sign up for the sample lecture. It will be a really interesting chance to learn about a topic and some of the research that Dr. Omri has done, but also to get a bit of an experience of what it's like to learn in the Master of Global Health classroom. Michelle is going to be one of the instructors for one of our courses in the Master of Global Health, so a great chance to connect with her and learn from her very deep knowledge and expertise in the realm of global health. She has a lot of experience and great kind of perspectives to share in this area. There's also another session that we're planning to schedule shortly, which will be around application insights and tips. So please take a look on our website, check your email for more information about when we'll be scheduling that, but likely in sometime in December. So that will be coming up. Wonderful. As I'm kind of moving towards this, I do want to open up our Q&A section. So how we'll be doing this, because we're in a webinar, is you'll have the chance to submit your questions there, and then myself and Lena and Kumbo will be working our way through to try our best to answer as many questions as we can in the time allotted. But let me just share with you, while you're starting to hopefully be able to see and populate your questions in there, let me share my last slide with you. So this is our website. The QR code takes you directly to that link. We encourage you to check out the information there. There's lots of great content and answers to questions you may have, as well as an FAQ, or frequently asked questions, which has a lot of good information there as well. However, we also encourage you to connect with us. So please don't hesitate to email us to ask your questions, so we can support you as best we can as you consider our program and as you prepare your application. We're really here to support you and really here to provide that guidance about the application process, maybe your career goals, your background and suitability, and support your next steps as you move towards applying. So let me stop sharing my screen for just a moment.